Hello, friends, and happy Friday. Yes, I'm here. Why is it always a scramble? Somebody always decides they need to go out right at the last minute, but that's, I've got this playing on the TV so that I can monitor it. And it seems kind of loud. Let me go turn that down right quick. Okay, let's try this again. So, I think you're in for a treat today. My guest is Dr. Amanda Lawson. She is a veterinary specialist here in the area who focuses on treating equines, horses, mules, donkeys. I don't know what I'm hanging up on here by my computer. Okay, maybe we're good. So I hope you're all happy and well. Let me get to the chat right quick. Hello, Jerry and Susan at Butler Family Farm. Thanks for stopping in today. I'm going to bring Dr. Lawson up here in just a little bit. I told her to give me 5 minutes or so I could welcome everyone and just let you know a little bit about her, the little bit that I already know. Thank you if you are watching live with me. Thank you if you're going to be part of the rewatch crew that watches later. It all is appreciated. And I need to get my little list of questions up too. If you have questions, as always, put them in the chat and we will pose those to Dr. Lawson together. Get this microphone a little closer to me. And I just heard my guest pop in. Give me 1 second here. Okay, this is a little bit better here. Oh, yes, and don't forget, tomorrow, Butler Family Farm and Simply Jan Homestead are doing a double prize giveaway for some milestones that they have reached on their channel. So you guys check those live streams out tomorrow. But I know Dr. Lawson because last year when it was time for Cabo and Delilah to get their checkups and their vaccinations, I had to find a new equine vet because the vet that we had been using no longer services this area. So she came out and spent some time with Cabo and Delilah. Cabo had been not really limping, but I had noticed something about his gait that seemed a little bit off. So she made some assessments there, didn't find anything real obvious and said, we may have to get him scheduled for x-rays or some diagnostic stuff. But she prescribed him some, I think it was like a horse ibuprofen, and he took that for about 30 days, and it resolved. So he's such a toddler. He's just a huge, 1,200-pound toddler, and it wouldn't surprise me to know that he just overdid it or stepped funny when he was doing his racehorse practice out in the pasture. But they love her and I love her, and I think you're going to love her too. So without further ado, let's bring up Dr. Amanda Lawson.
Hi.
Hello. How are you?
I'm good. How are you doing?
I'm good. Obviously, it's a sunglasses kind of a day.
It is,
but
yes.
Do you think fall is here to stay?
I hope so. The weather is amazing.
This is perfect. I keep wishing I could figure out where on the planet to live where it's like this all year. And I think there are some places, but not places I could afford to pack up and go and haul a bunch of animals. But
oh, for sure.
This is amazing. We have friends that are spending a lot of time in Colorado. So obviously it's been cool and even cold up there already this year.
Yes.
A lot of times
when we're in the winters.
No. A lot of times when we're in the thick of the heat here in the summers, he'll send me a text and say, "Hey, what's the temperature there?" And I'll tell him, and then he'll say, "Oh, well, it's 74 degrees here." Oh,
yes.
Just to live it in good fun.
So nice.
Tell us geographically where you are. I don't need addresses or anything, but where, when you go home, where does that mean?
I go home west of the DFW Metroplex.
Okay.
Yeah, and Weatherford is where I live.
Okay. And then how big is the area that you work when you're tending to horses?
Anywhere, our radius is about an hour, sometimes longer. So if I'm on the far end of my hour radius and somebody's on the other end, then it could be an hour and a half or so.
Okay. And I
Mhm.
imagine you get asked this question a lot. What motivated you to become an equine veterinarian?
So, I grew up in a military family and I always wanted a horse. And we moved often, and I was always told I couldn't have a horse. So, when I got of age, I had I'm from a very small town. I had my local school bus driver drop me off at the Humane Society after school every day, and then I would walk home. And so after that, I was like, yes, I want to be around animals. And that was probably in the 5th grade. And my family said that from that moment on, I said I was going to be a vet. And I just kind of gravitated to the large animal side. I was always working cattle. I worked at a dairy farm. And then from there, I just kind of transitioned to the veterinary medicine side of it and was a technician at a large animal practice back in Tennessee.
So it was more the working with animals and not the medicine at first, at least.
Yes,
right?
yes. I wanted as many animals as I could.
Uh-huh.
So I always wanted to be around them.
So you didn't grow up with horses for
No.
logistical and practical reasons, but did you have dogs? Did you have birds? Did you have other animals?
Ended up adopting one dog from that Humane Society, and I had her up until a couple months before I started vet school. Yeah, in 2009. So
what kind of dog was she?
She was a little Chihuahua rat terrier mutt. Just a little dog that my parents said that I could have because she didn't take up much space.
Yeah, nice. And what was her name?
Katie.
Nice. Do you have a dog?
That was her name when I adopted her.
Do you have a dog now?
I have so many animals now.
Okay. Obviously,
they came in tenfold
because they're on the thumbnail. Those are her equine babies that are on the thumbnail for today's show.
Not all of them. Some of them are patients, I think. I think most of those are patients.
Okay.
I have 5 dogs, 2 cats, multiple chickens, like 40-ish chickens, 2 donkeys, and a pony.
Oh my goodness. Yeah, you got me beat.
Yes. Yes.
So, and these are pets. Do you raise meat animals? Do you do?
No.
Okay.
They're all pets.
Okay. And your chickens, are they good egg layers?
They are, yes. Okay. Right now, not so much. They've all
what's
fallen
up with
off
that? Yes. Okay. So obviously that's just a thing right now because I had been collecting. From the time change, we raised ducks and geese, and I had been collecting like more eggs than we can eat, and I even scramble them and feed them to the dogs. And now they have not laid an egg at all. I think in like a week.
Yeah, I sell a lot of eggs, and
I give stuff away like crazy.
People have been asking, and I'm like, I don't even have enough eggs for myself.
I wonder.
So I'm sorry.
Yeah, a couple of summers ago, I thought it had to do with the extreme heat and drought conditions, and that was probably impacting just their ability to produce eggs. Yeah. But now it's been so mild and so pleasant, and again, they were really, really producing well, even through the summer this year, consistently laying eggs for me. And now I know we have a rat snake too, because I see him frequently. And that's always a possibility that he's helping himself to eggs to keep himself fed, which is okay with me because that's why we don't have rats in the duck yard and in the pen. So, but I'd like to have some to eat.
I know.
And they're not producing enough for that. So, military family, did you travel growing up?
Not a lot. My dad was stationed in Fort Hood. For most of my life. We did live in multiple other places that I recall, Georgia being another one, but mostly just here in Tennessee is mostly what I remember. And then my parents ended up moving back home to Tennessee when my dad was getting out of the Army.
Okay. So how long did he serve?
I don't know. He was in Desert Storm. I never really asked.
Okay.
But most of my
childhood you remember? Okay.
Yes.
Hey, thank him for his service for me.
Yeah, I will.
We are a Marine Corps family. My
Yeah.
husband was Marine Corps. Our youngest son was Marine Corps. My dad and grandfather were in the Air Force, and it was not my calling. So I'm that much more appreciative of the people that really did step up and take on the burdens that come with that. But things that I have wanted to ask that, and again, if you're in the chat and you've got questions for Dr. Lawson, feel free to post them in the chat. I'll get them on the screen and we'll pick her brain together. But I am wondering first, is there like a top 3 most common issues that you tend to diagnose and treat for equines in the area or over your career?
Lameness is huge, whether it's something simple like an abscess or it's maintenance injections is needed. That being a true issue is what we commonly see. Eyeballs, eyes getting ulcers or foreign bodies in this area. Sandburrs can get in the eyes and cause some catastrophic injuries. So that's also a big one. And then a third one, I don't know. I feel like we see some neurologic factors. I don't want to say, oh, it's a top huge one. I guess I should say colic. I should say colic, that one's huge.
The one everybody's terrified.
Yes,
for good reason.
Absolutely.
I'm not going to knock on wood because I've learned when I knock on wood during a live stream, my dogs start barking and going bananas. But knock on wood, we have not dealt with that with any of our equines yet.
That's good.
So, but we really try to be mindful about diet and, the husbandry that goes with equines, at least. My friend Jerry is wondering if you ever look at llamas or cattle or things like that, or has that been part of your practice?
No, never.
Okay.
I did want to be a cattle vet. I really did. I wanted to be a dairy vet. Like even through undergrad, I was like, man, I think I'm going to do dairy. And then I just kind of transitioned to equine. When I worked at Tennessee Equine Hospital as a technician, not as a veterinarian, they did have a huge alpaca farm that we would go to. But other than that, I have dabbled a little, but a lot of the medications are different and I just don't carry them in my truck. And it's difficult. Most people want us to go out to their place and work on their cattle, but they don't have the facilities or a chute or anything like that. And so it's hard. How do you want us to? I'm not going to go out there and rope it. That's for sure.
Yeah. Oh, yeah. And that's always fascinated me. You made mention of medications and differences for various species. Mm-hmm. I am still really intrigued. I remember we had a horse years ago, and the doctor put her on Previcox. Mm-hmm. Off-label Previcox, which did help a little bit for her, but I was amazed that she could only have a fourth of a pill, the same pill that I could give the whole pill or maybe a pill and a half to my dog. She could only have a fraction of it, and it really began my fascination with just how different species metabolize.
How they metabolize it differently, yeah.
And yet it could still have the same effect for her to have she wasn't a big girl. She was just an old quarter horse mare, not where weight would have factored into what her dosage would have been. But I was so intrigued by that. And it makes me wonder, I'm going to imagine that chemistry and pharmaceutical science and stuff like that was a big part of your education and training. But how do you, I guess you don't have to maybe keep track of so much now because you specialize.
Yes.
But as you're learning, do you still have to know about it for a lot of species?
Yes. At University of Tennessee, where I went to undergrad and then my clinical year of vet school, you have to learn everything. Some veterinary clinics or schools, I guess I should say, some veterinary schools, like I think, North Carolina State, I think they track still, meaning you can focus on primarily what you want to practice in. But every single vet school, you have to learn all species, birds, exotics, and all that.
Okay. Which is very like human medicine.
Yes.
You don't become a specialist from the day you start classes.
Yeah, absolutely.
What in your educational story, was there like this big thing you learned at some point that you thought, wow,
Like in general, or
just in general? I mean, about veterinary medicine, but maybe something that, okay. Okay, well, that's good. Okay, no, that's good though.
I think I'm kind of different. Like, I think a lot of your mentorship after graduation is your huge learning curve.
Okay.
How you communicate with clients, how you handle the animals, and your true hands-on and like practicing of veterinary medicine is your key. Man, books are so nice, and that is your like building block of being a veterinarian. I feel like if you're taught appropriately and have a good mentor, they'll teach you all the additional building blocks that are actually more of a foundation of how to keep your clientele happy, how to build clientele really nicely, and then just go from there.
And are you still connected with the people that mentored you?
Yes, I worked there for 6 years.
Oh, wow.
I actually texted him the other day and just said, "Do you miss me?"
What was the response?
Terribly bad, he said.
What a wonderful legacy then that you're already leaving behind. Regarding those top issues that you said you've had to deal with, are lameness. We'll talk about lameness because I know there can be various causes for that. But is that something that in the grand scheme of things, it's, I don't know if I want to say easy to manage, but is it something that is typically successfully managed once you've diagnosed it and put a plan together?
Yeah, sometimes it definitely depends on what it is. It could be something as simple as an abscess from the rain and the wet ground. It could be something as bad as a nail went into the foot and went into a really important structure, and then now it needs to be hospitalized, and then that area lavaged. It could be just maintenance injections. You know, even your backyard horses, if they have arthritis in a certain area, they might need maintenance injections. It may not be as often as a performance horse, but a lot of times it helps significantly, like us, if we get our shoulder or our knee injected, you know, due to pathology being in that joint.
Okay. And maybe this is a weird question, but if a horse could talk, what do you think they would say is the biggest need they have that is often overlooked by their guardians?
I feel like a lot of cervical, like neck pain, is overlooked.
Aww.
Just a lot of times in performance horses. And then I've done a couple of CEs at Colorado State, and they talk largely about intermittent lamenesses, or, you know, lamenesses that are off and on that are cervical or neck related. And it's kind of overlooked, or, you know, put on the back burner because they don't really see much of a lameness, but it could be a behavioral problem.
Oh, how sad.
Yeah.
And are horses as good at, I guess is the way to say it, as at masking pain or discomfort as, say, like cats? Like cats can be end-stage kidney failure, and
I feel like it could, yeah. I feel like it could be almost breed, almost. Like, I feel like Tennessee walking horses are super stoic. Mules and donkeys are really stoic. But you could have a quarter horse and they are, you know, as bullheaded as they come, and they're like, I'm not going to show pain as well, you know. But you would specifically know that horse and say, okay, well, this is definitely not how my horse typically acts, and is it pain or discomfort or whatever it may be.
Yeah, I definitely think Cabo would be the drama queen among horses.
Are very
and I do think I don't remember him being mean, quote unquote, when he was having that weird gimpy back leg thing. But there have been times that he's just like particularly bratty. And I wonder, what is he trying to tell me? It makes me wonder, what is he trying to tell me? Why was this encounter not him coming over and rubbing his nose on my shoulder? This encounter was coming over and hitting my shoulder with his nose. And it makes me always think he wants something or he needs something, and he doesn't know how to tell me. Whereas Delilah, she's the same all the time.
Yeah. And it's funny. People always say a donkey will love you, whether they, you know, you can come and give them food, and a donkey and a mule will be appreciative of it. And then a horse will turn around and kick you in the face and be like, we don't care about you.
Yeah.
Thanks for my food.
Yeah. About time you showed up.
Yeah, absolutely.
Right. So emotional relationships with equines, because I can't help but instantly think about that for an equine veterinarian. I think maybe the same could be said for like a small animal practitioner that deals with dogs or something else that really connects with humans well, and they communicate maybe a little more easily with humans, or at least humans can pick up on it a little bit more. But the more I've learned about horses in the years that I've had equines, the more, again, it's another thing that fascinates me, is they are emotional creatures. And I don't think, that's maybe true of a lot of big animals. Like I've learned a little bit about elephants, and they're just so
Very
family oriented, and they're they remember things, and they form very, very deep bonds, and they grieve, and they, and the emotional part of being an equine veterinarian. What's been the best and worst parts of that for you in your career?
It's the same. I tell people I don't own a horse, but I treat every horse that I see as if they are mine.
Nice.
Because my donkeys have this love connection, and so does my pony. But, obviously a horse is different, and it is nice to have those connections with your patients, and they are happy to see you, and you give them kisses, and they nicker at you, and they love you just as if, you're a part of the family as well. It does get emotional, especially because you build a bond. And I've been in this area for 6 years, so a lot of my clients have been with me since 2019. And so their horses I feel like they're like my horses. And if something is wrong with them or sick, or, if we unfortunately have to euthanize, like, I feel like I'm thankful that I'm a part of the journey for the entire 6 years, and that I get to at least give the gift of me being the one to do it, and not like a random veterinarian,
or
unless,
they just go down on their own and there's nobody there.
Yes.
Yeah. What a beautiful way to see that, though.
Yeah.
I think that's one of the biggest lessons animals can teach us, is how precious the connections are, and that they have a purpose beyond, like if you're a horseback rider, it's a purpose way beyond having a good riding horse or show horse or breeding horse.
It's a lot of trust.
Yeah. And what it means in the end, whichever place the end is, the human is no longer here, or the horse is no longer here. I don't know that enough people appreciate that. I feel like a lot of people, again, because horses aren't as, I don't know what word to put here. Like our dogs, they live in the house. Some of them sleep on the bed. They're
still used as livestock. Day cowboys, that's their means of having a way of making money, and that's their life. So it's kind of like their mode of transportation. Every day we take care of it, but it's not like our car is a part of our family.
Right. Oh, yeah. Okay. Yeah. Oh, yeah. That's a nice way to explain it.
Yeah.
But it must have been. I would just think, again, for me, if I did the kind of work you did, that's what it would be about for me. I mean, obviously I would want to be a great doctor like you are, but I would just eat up the connection, the emotional connection. And especially when you've got clients, patients that have been with you since you moved to this area.
Mm-hmm. Yeah. And some of them don't care about me, and they don't like me.
Yeah. Well, again,
that's fine
too. Can be like that too, right? Yeah.
Yeah, absolutely.
No surprise there. EPM is that, because there's another thing, it's like second on my list after colic that I worry about, only because, again, we have a lot of critters here, and we do have possums around a lot. I just saw our resident female that is around from time to time. She stays pretty hidden most of the time, but she just happened to be out the other night when I let the dogs out before I went to bed. And is that really, is it prevalent here? Is it something?
Very.
Okay.
Yeah. In the southern states, Texas is huge. It is very prevalent. Even if you keep your hay up and your feet up, wildlife can come into your grazing pasture or into the area. And it is a protozoa. So they just pick up the eggs from possum poop. So it doesn't even have to be, eating the pile of poop. It could have been spread from the poop onto the ground and then them eat it.
Oh, wow. And there is or isn't like a vaccine against
No vaccine.
Okay.
Yeah.
Okay.
There is gold standard treatment. Still, they consider the gold standard treatment. It's called Marquis is the name brand. It's like saying Banamine is the name brand for Flunixin. And then a lot of times your horse has had exposure.
Oops, looks like we lost you there for a second. If you're just now joining us, let me put up a little banner here. This is Cabo and Delilah's vet, Dr. Amanda Lawson. I lost you there for a little bit.
Oh, yeah, you were gone.
Yeah. Oh, I was gone.
Where did I get to? Where did I cut out?
You were talking about the Gold Star treatment for EPM.
Yeah. And that is called Marquis. It's kind of like Banamine for, the brand name. But it's all about exposure. Most horses have had exposure, and that's when we draw the blood and we test. It doesn't test to say your horse is clinically significant and it has clinical signs. It just lets us know if it's had exposure.
Okay.
So if your horse has had exposure, then at any point in its life, if there's any kind of stressor that could cause the immune system to be suppressed, that's when clinical signs can start to occur.
Okay.
Whether it's behavior changes, muscle atrophy, performance related, actually truly neurologic and falling over.
Okay.
And so to truly know if your horse has an EPM, clinical signs and infection, you have to do a CSF tap, from your cervical vertebrae, and then compare that to the blood, and then it would truly let you know if there's an infection. Now, probably controversially, we're all mostly, I don't want to say cookbook, but we're all going to reach for the medications and start treating your horse with its neurologic symptoms, whether we have the test result fully right there or not, because, starting treatment is key.
Right. And I guess it would kind of go hand in hand if EPM really is prevalent here anyway, that most equines in the area probably have been exposed. You could do the test and see there's been exposure.
Mm-hmm.
Yeah. Is it something, does that result in any kind of antibodies or anything being produced in the horse or the equine if they have exposure?
Yes, but they can have continued incidence of the disease as well.
Okay. So it's not as protective as once you get the chicken pox, then you have protection against the chicken pox. Okay.
Yeah.
What would you say is the most rewarding part of your job?
I always say seeing the real bad cases, like where I used to work, it was different because I would see the horses in the field, and then I would end up also having them in the clinic. I would bring them in from the field and we would treat them because we were a referral hospital. Now it's a little different because I don't get to see the end. I just hope that it's all done and said, and that, no news is good news and the horse lives. But I loved seeing those cases that were probably pretty tragic and then them being totally fine.
Nice. And I probably know what your answer would be, but what would you say is the worst part of being an equine vet?
I hate saying this, but when I give advice, and then the advice isn't taken. I just feel like if you're paying me for the advice, I don't usually beat around the bush. I'm a pretty straight shooter, so I'm not just going to lie and say, oh, I think it's this. I would truly say, this needs to go into a hospital. This is a significant problem. And then, if it just hangs out and then it dies a horrible death, Yeah.
And I can't help but think, so I have a healthcare background, and what you're describing is what most medical, whether it's human or animal or not, practitioners struggle with all the time. People will schedule an appointment for an evaluation or x-rays or testing. There's a diagnosis made, recommendations are made, and then, 3 months later they're back and it's worse, and they act like they don't understand why it's still there.
Mm-hmm.
And you just ask them, did you finish this prescription, or did you go and see Dr. So-and-so where I referred you? And of course the answer is no. And you just, bite your tongue with some
Absolutely.
people. But I just feel, it makes me feel worse to know when it happens with animals, because the animals can't speak for themselves. The animals can't call the doctor again and say, hey, this still hurts, or hey, this is still not working right. And they're so dependent on us.
On having a good advocate. I feel like it's
Yeah.
almost the same in the human field. If unfortunately, like a family member doesn't know that much about medicine, your person advocating for you might not make the correct medical decisions that need to be made. And unfortunately, animal, they can't make those decisions on their own. I one time told a client that was very frustrating to me. I said, this horse would have probably picked a different owner if it could have, to make sure that its life and care would have been taken care of if it had known, but it didn't have an option. It has you. So you have to be the advocate.
You can hope that maybe you plant some seeds at least when some things like that happen.
Mm-hmm, for sure.
So, you prefaced what you were going to answer by saying, I hate to say this. Don't hate to say that, because part of the reason I love to have interesting professional people on the show is because very few people ever really get the opportunity to understand and appreciate what it really means for them to do what they do. Like what you do, I'm sure a lot of people just think, oh, what an amazing, glamorous, what a fun, easy job, or whatever their perception of it is, because it's not something they do. It's not something they've ever done. Maybe they've never known. Maybe they don't have horses, and they misunderstand, and they lose the opportunities to really be as thankful for people like you than they should be, than they could be. And that's really, I really love to raise awareness on the show, again, by having people come on and be honest. Whether you're going to preface it by saying, I hate to say this, people need to know it, because there might be one person that'll see this stream sometime and then think back, because maybe their horses just had a checkup last week and the vet may have said something, and they realize, oh, I never did go out and do that, or fix that, or change the feed, or whatever might have been recommended. And maybe they'll stop for a second and think, you know what, I'm just going to go do that now, because now it's not just me and my horse. Now someone else has to be concerned about it. Now someone else is invested in the outcome, and someone else who knows a million times more than I'm ever going to know has already told me what needs to happen. So don't feel bad about
it. And there's it's funny, those memes that go around saying there's a zero charge for me thinking of your horse at night. Like, I'm sure it's like that with all professionals, of thinking of people outside and after hours. But it's true. Like, we always wonder of, like, are they doing okay? Or, things like that. Because I do assume no news is good news, but then sometimes it's definitely not.
Yeah. But see, people need to know that. People need to understand that. I mean, I know there are the big mass chain clinic places, at least for human health care, that, they probably don't know you. They would see you even and say, oh, you're patient A2147. Like, they wouldn't even know your name. You leave, and then they don't know unless you call back. But when it's more of an intimate kind of relationship, a country doctor or an equine vet, or someone that's not part of those big mega institutions, I don't think people understand that yes, you worry, especially if it's a serious condition, and maybe you were waiting for them to follow up with you. Maybe you're waiting for them to call the office and say, hey, I got the test back from Dr. So-and-so where you referred me, or, something.
Luckily, our referrings in the area are so good. Most of them, probably 95%, they all get back or shoot me a message. It's a very small but large community where most of us know each other, and they will send me a text message, and say, hey, this is how it's going, which is super nice.
Okay. Now, your tech that has come with you when you've been here, How do those matchups happen? How do you find a tech? Do you have a tech you work with all the time? Is there just a
I have
pool of people?
two.
Okay.
Yeah. So where I used to work, we would have a lot, because it was a big facility. And so I was also field services there, and they all kind of wanted to go on the road. So to make it fair, we just would rotate. So I would have a new tech every day, but it would just kind of be on a rotational basis. When I first moved up here, I kind of posted on social media that I was moving up here and I was looking for a technician. And one of my old techs that used to work with us, she was working at Texas A&M, and she knew somebody that was moving up here, and she was a tech. So that's how we first linked, and she moved up here, and she was my tech for the first 2.5 years. And then kind of after, I just had some people, kind of in and out. And then recently I've had these two techs for a few years now. One of them was one of the small animal technicians here, and so she kind of does both. And then the other one I met from working at the Humane Society of North Texas.
Okay. So that would be, I would think, a really important part of your work is to have a partner, a teammate, someone that knows how you work and knows what you need so that you can do your job safely and
know what I'm thinking before I think it.
Yeah. Oh, yeah. That's perfect. Yeah. That's, again, just like medicine. I was a surgical dental assistant for a long time.
Oh, yeah.
And, you do that long enough then, and then you already know before the doctor's doing the thing that's coming next, this is where you need to be. This is what tools are coming. This is what area you need to work on. And I see that same thing. And I watch for that. And I like to see that when you're here or when we've had other equine vets come out, because a horse, even a very nice, calm, sweet, gentle horse, can really do some damage to somebody if they're not paying attention or they don't know what to anticipate. And it's very much like a choreographed thing, I feel like, when you have professional people come out and deal with sometimes these really big equines. Let me see if I had another question for you. So what keeps you motivated? Let's say you've had a week of, several families where you recommended something when you were out to see them last time. They didn't do it. And now here you are again, and it's worse than it was. And it's obvious that the horse is in pain or has trouble walking or whatever it is. But what keeps you motivated when things don't go like they should and like you might wish they would go?
I always say the younger version of me. Like, I prayed, I wanted this job, when I was little, and I never even considered never being a vet. So then I'm like, I need to do the job that my younger self wanted to do,
Sweet.
Yeah.
Sweet. And wouldn't it be
pull up my bootstraps and keep going?
To me, that means you really answered a calling. You really are, it's a passion. It's not just, oh, I went to school to be a vet and now that's what I do. This was like you before you ever had, DVM after your name.
We get asked that all the time. And when I was an intern, we would get students through, multiple students a week, and we were getting ready to lay a horse down for surgery, and a student asked, what made me want to be a vet? That's your most common question. And I said the same story of, I had the bus drop me off at the Humane Society, blah, blah, blah. My intern mate said it was the card I was dealt. And that kind of chapped my butt. And I've thought about that, like, literally my entire career. And I'm like, I feel like, why? You can get, if that's how you feel about the career, you can get out of it at any point in time.
Well, to me, it makes it sound like you weren't even involved in it. To me, it sounds like it was, you didn't have any choices. Here's your life in it. And I'm not sure what anyone would even mean by saying that. Well, I don't even understand why someone would say that. So I can understand you being kind of irked or uncomfortable.
I was like, I just kind of looked over and I was like, what? Like,
you should have said, oh, yeah, poor me.
Decisions that were made.
Oh, I'm just so sad. Yeah. What a weird thing to say. Do you have, like, your top tips for people who maybe they're looking for a horse. They don't have a horse yet, but they want one. They've always wanted one. Let's say they already have the setup. They've got shelter. They've got forage land. They've got, everything is ready, but they want a horse. They don't know how to pick. They don't know how to decide. What would be your top, pieces of advice before someone really did add a horse to the family?
Always look at a horse without a saddle on. I feel like a lot of people will sell pictures up. The horse is always saddled. There could be a sway back or something, and you don't know unless you take the saddle off and take a look. So make sure you see the horse completely unsaddled, no bell boots, kind of nothing, tackless, essentially. Next, if there's a huge shoeing package on the front feet of that horse, it probably has a foot problem. If you're willing to take on that problem, then rock on. But if there's a huge shoeing package, I would definitely undergo a pre-purchase exam. I definitely recommend a pre-purchase exam. Even if you don't want to spend the money on a pre-purchase exam, at least just do a lameness evaluation. Most lameness evaluations are $150 or less, depending on, like mine's $90, depending on where you go. At least have the horse looked at on hard ground and see if there is a lameness or not.
Simple enough, yeah.
The other one is have somebody of some expertise. Most people have their veterinarian's phone number. Send a picture of the horse's teeth to the vet and say, how old is this horse? Because the horse is always 12 and it's truly like 28 or something else. But you're always getting sold a younger horse than what it truly is.
Okay. Or you mean an older horse?
An older horse than what it truly is, yes.
Yeah. So,
they advertise it as a younger horse, yes.
Yeah. Our first, Cobble was our first horse, and then we had another, that quarter horse mare that's no longer with us. And all we knew, now this was not anyone's fault, and this was not a deliberate, they weren't hiding something. A big herd down near Houston had been rescued because the owner passed away. No one in the family was in a position to go down and care for all of them. So the Humane Society rounded them all up and started, finding homes for them. And that's how she came to us. And all they could tell us initially was, we know she's probably about 20. And that was just, again, looking at body condition and what little there was in the way, I think, of records from the property. But as she began to develop health problems before she passed over, even our farrier said, I really think she's close to 30 years old. And then as the vet was coming out more and more, because I feel like the vet was out here like once a month for the last 6 months that she was with us. And he would say, I would definitely put her over 30. And they were kind of saying that to comfort me, because they knew the time was coming. And that they're not meant to live forever. And, but again, we were just rescuing a horse. It didn't matter to me, is she a young horse? Is she old? Is she, going to be with us very long or not? We had a spot for her, and Cabo needed a companion, and it was a great match while she was with us. She was the most precious, most precious girl. But she was just much older than anyone estimated initially, just when they made their assessments, when they went and looked at the herd. But I do know that people will fudge a little bit when they're trying to sell a horse, or even just give a horse away because they don't want it, or they can't keep it, or they're moving, or whatever.
Yeah. Even if you know the people, like, I hate to say don't trust, but man, I feel
trust
like
but verify.
Horse people sometimes are just not the most trustworthy, and I don't like to say that, but it's the ones that kind of make you learn that the hard way is what makes you realize, no, I need to have a professional opinion and see if it truly is this or not.
Well, and to me, the big takeaway there is that it is not cheap to be a horse parent. There is nothing inexpensive about, my flock, for example. So I've got, 20 birds in my flock, and I can, the same money that I spend to keep them fed will feed them for, 2 weeks, whereas every 5 days we're spending about that much to keep our 2 equines just fed, just feed, or hay or whatever.
It's not for the faint of heart. That is, and a free horse is definitely not going to be free.
No, never. So yeah,
No.
so great advice for people. And in your experience, because I'm sure this comes up frequently, you how often do you meet people that, it's a first horse and they literally know nothing about being a herd leader or being a horse parent, and the horse will sometimes really, the horse will show you that.
Take advantage.
But
Yeah.
yeah, but is that as
Pretty
common as?
often. I love a new horse owner though. Like I would love to be the one that gave the education, because I feel like I'm so direct, where I feel like if you listen to so and so, so and so, so and so, they're just gonna, kind of not bully you into it, but let you know it might be a horse problem. But I see that pretty often. Or say it's like a kid horse or a high school horse or something like that, and the horse is getting away with these bad behaviors from the younger horses, the younger riders riding, but then they don't even think about trying it with an adult rider. It's just they try to test the water, and it's truly knowing, is it them testing their owner or not.
Okay.
And I had that the other day. I had a client want me to come out and help her load her horse. She's been having difficulties. I'm not a trainer at all. This is not my job, but I always feel guilty, and so I went. But then after learning and watching, the horse would turn around and try to come back out of the trailer, but she didn't do anything to stop the horse from wanting. So it's just like little things that maybe other people may see that you might not know or catch on, that definitely changes. And the horse was like, oh, well, I can just run this lady over, and I'm like, you're not going to run me over.
I love it though that you approach that by saying, I love working with a new horse owner.
I do, yes.
That way then they don't have 20 years of bad habits and bad attitudes and bad practices, right? You really can't.
And I think that's what I love about field services, is because if you go into a hospital with your horse and you're like, I'm a new horse owner, and I love being able for people to haul in, because that's a huge need. But I love that I'm at people's places. I can see if it truly is like good husbandry. Is the fences bad, or is the way that they're feeding the horse in an inappropriate way, or is the water, so like you truly see where they're living to say, I personally wouldn't do this, but hey, it's your place, it's your horse. If you see any problems, then maybe change it out.
Okay, good. I like that. I just like that attitude. Let me see if I have another question for you. How can people who aren't horse owners, maybe they've never wanted to be horse owners, they're never going to be horse owners, but how can they learn more or support equine health? Is there a way they can still, again, here, maybe this isn't relevant in other parts of the country, Texas in general, it's relevant, but right here, I mean, even just on our street, you just do a drive, a little bit west of here, and there's several properties of horses, a lot of boarding places,
in that area,
and
it's huge.
And
there's a lot of local riding academies. A lot of them do like horse camps, especially in your area, and they will teach like animal or horse husbandry, how to properly walk a horse and pick up their feet and brush them, like the simple things that we don't even think twice about, that they think about. And then did you say donate? What the other question was? It donate,
support equine health, or
be cognizant of where you would donate funds for supporting. A lot of people say that they're rescues, but then they're truly hoarders, and they are a big problem of the problem that goes on. There are lots of phenomenal organizations that truly help those kinds of benefiting horses that are truly in neglect or abuse, that work with local law enforcement, and not like, I'm rescuing this horse to then fix it. Sometimes rescuing and things like that, they need to be euthanized. They don't need to be tried to fix or sold.
Yeah, because it's not fair to the animal.
And that costs money. So there are some really good organizations that do that, and then there's some just do lots of research. Don't take it at face value. Definitely ask around. Reputation is a huge key.
Okay,
It'll precede people.
when you're not in your veterinary uniform, which y'all are veterinary uniform is not a uniform, it's jeans.
No, it's just a scrub top and jeans.
That's her work uniform right there. But when you're
Yeah.
not doing that, what do you like to do? Do you have hobbies? Are you musical? Do you paint? What kind of things do you do when you're just
I'm not creative at all. I wish I was. I love music, but I train jujitsu. I try to go 2 to 3 days a week, you know, if I'm able to. I compete. That is my
That's so awesome.
legal outlet of
all these things that irk you. Yeah.
Yes. I really like it. It's great. It's awesome for your cognitive thinking, your mental health, your physical strength, because, you know, our job is also physical. So just cardiovascular wise, it's super good.
Okay. And what else was I going to ask you? Oh, then I like to end on my goofy question. You're stranded on an island.
Uh-huh.
You can only take 3 things with you, or you can only have 3 things with you on this island. What are the 3 things?
Potatoes. I love mashed potatoes, but you can fix potatoes multiple ways. Okay. So I feel like I could get a lot of stuff out of potatoes. You know, I don't want to say phone because I don't like being connected to my phone all the time, but I love like music and entertainment, you know? That way you can talk to your other friends. And then I would take an animal, probably a dog. Obviously I would want to take all mine, but I could not be anywhere without an animal.
Okay, yeah. I feel like sometimes I learn more about a person with that last little final question than with all the things I might have asked during the interview, because they're never prepared for it, which is my objective. But it makes me see, do they lean more logical? Do they lean more practical? Are they more spiritual? Are they more intellectual? You know, what's really at the heart of them, that if they really had to make those kind of choices, I think you'd probably do okay on an island then. But I feel like I've kept you long enough. I'm so grateful for you taking time out of a day that you had available to come and spend with us. And even though I feel like I'm relatively knowledgeable about equines and equine health, I always want to learn more. And I learned some things today, and I appreciate you.
Thank you.
I support what you're doing. I was very interested in human medicine for my whole life, never considered veterinary medicine, and I don't know why, because frankly, I really like animals a whole lot more than I like most people. So,
absolutely.
I wonder, why did I spend so long butting heads with people in human healthcare settings? But I learned a lot. If nothing else, I learned a lot about me and, you know, what it takes to fill my cup. So I appreciate you. This has been a wonderful day for me. And again, I'm so thankful that you were willing to be on the show. And just keep doing what you're doing, because you're just such a perfect natural fit for
thank you.
All right.
Thank you so much. Thanks for having me.
Yes, and have a wonderful weekend. Hopefully we will not be calling with any kind of news about anybody until it's time for vaccinations and testing and stuff again.
Yes, ma'am.
Thank you, Dr. Lawson.
Bye.
Bye. That was Dr. Amanda Lawson. I hope you guys learned a thing or two. So many of my interviews give me opportunities to learn something that I didn't know before, which is for me, that's a very motivating thing. It's a motivating factor for just being alive. I can't imagine how boring it would be if any of us ever reached a point where we really knew everything there was to know, which is why that's not possible. There are some people out there that sure act like they think that's what's happening. But I hope you have a greater appreciation now, too, for veterinary medicine in general. But for those of you that have horses, big animals, maybe think on that a little bit. It does sound like an amazing job to me, but there's so much more that goes into it than, you know, the schooling and the practicing before you're out on your own. And it's not because that's the card you were dealt. And Dr. Lawson is just such a great example of someone who, again, is answering a calling, And that's why she's so good at what she does. Y'all, Cabo's even nice when she comes around. He can be so bratty sometimes when new people come, just because I think he's testing to see how much they know or just see what they can get away with. He's just a big toddler. He is a big toddler. If I had a nickel for every time he's come up for dinner from being on the back acre and he's got a scratch on his rear end, or or he's got all kinds of burrs wrapped around his mane and everything because he squeezed himself through some brush back there, I'd be in millionaire territory by now, I think. But I am very dependent on people like Dr. Lawson to help me be what my equines need me to be. So I hope you enjoyed the show. Next week is our sound therapist. I'm going to get that stream set up today. She did send me all of the info a few days ago, but I just have not sat down to get that stream set up. I think that's going to be very interesting because I don't know enough about sound therapy to feel like I can, truly appreciate it. So we're going to learn some things together about that as well next week. I hope you're having beautiful weather where you are. It really is perfect weather here. This is what I wish it could be every day. Rich and I will be back on Thursday next week. Who knows what we're doing? If you missed last night's show, we played a new game. I think it went pretty well. So check that out. And this Sunday night, classic movie night, is an old Mickey Rooney movie, but maybe not the Mickey Rooney that you think of when I say the name Mickey Rooney. So check it out. I'll look for you at 7 o'clock at the premiere. And I should have a recipe video going up soon. It is close enough to Thanksgiving that it might be time to share some holiday recipes with you. So be watching for that. And be safe, be happy, be well. I love you all. And I will see you in the next live or the next video. Bye, friends.